The webinar will begin shortly. Please remain on the line. The broadcast is now starting. All attendees are in listen-only mode.
All right, good evening, everyone. This is Herb Atchison, the Mayor of the City of Westminster. I'd like to invite you to our April 20th, 2020 Westminster City Council study session. We have already confirmed that all members of the council are present on the call, senior staff as required, and those who have input to the items that we'll be covering tonight. We only have about 5 items that we'll go through tonight, but we want to start with some of the most pressing issues right now is any potential of a re-entry to normal business. Things are changing from this morning to this afternoon, and tonight we've got a very special guest with us, Dr. Mark Johnson with the Jefferson County Public Health. So Don, I'll turn that portion over to you for a moment.
Well, thank you, Mayor. Yes, as you said, we've got Dr. Mark Johnson. He's the Executive Director of Jefferson County Public Health. Just briefly, because the gentleman has quite a background. He has education in the area of medicine from Johns Hopkins University. He's had private practice, public health experience, and a distinguished career in the military, where he retired as a lieutenant colonel in the Army. He has more awards and distinguishing accomplishment recognition than most people have on their full resume. He's an interesting guy. Also because he has the ability, from what I've noticed, to translate some fairly complicated subject matter into a way that I think is digestible for most of us. I was impressed with him a couple of times as he made presentations to groups I was associated with, and I think you will be too. He has a short presentation. I'd suggest if council has a few questions for him, we take questions right after his presentation. And Dr. Johnson, you're welcome to stay on for as much of the meeting as you want, but I know this is an extremely busy day for you in particular. And I just want to tell you, thank you so much for agreeing to join us today. So with that, Dr. Johnson, take it away.
Thank you very much, Don. I appreciate that, and I appreciate the opportunity to meet with you all. I wish it were in face and we could talk as humans normally do in social situations, but unfortunately, we are stuck with what we can do. Thank you. I want to give just a little bit of background as to where we are as a state and where the local public health directors and the state health department are looking as far as what the future holds for us. Right now in the state, we have had almost 450 deaths. We've had 449 deaths so far from COVID. Over 10,000 cases of COVID, and as we speak, there have been 1,880 hospitalizations in the state. Jefferson County has had 36 deaths, and we have had 1,002 cases. One of the issues that we are looking at is what are the trigger points that we can look at to begin to reopen the society and reopen the economy. The governor sort of stepped out ahead and made some pronouncements today, as I'm sure most of you have heard, that he is looking at, on April 27, beginning to loosen up the restrictions that are in place, taking off the stay at home, with still some guidance up until May 4, when he hopes to have up to 50% of people back in offices. The local public health directors, of which I have been working as one of, have looked at what the triggers we think are necessary to open society. They match very well President Trump's guidelines that he came out with over the weekend. And that is, we feel that it is necessary to be able to have a good testing program so that we actually know how many people in the community who have symptoms are positive for COVID. Also, that we can then zero in on where are the hot spots in the community and begin to do what's called contact tracing around those individuals who are testing positive, and so that we can hopefully, called ring containment, and contain that to just a small portion of the population instead of having it spread through the community. The third thing, other than testing and tracing, is treating, and we are have been very concerned up to this point as to how our hospital systems are able to care for those who are coming in with COVID-19. As most of you probably know by now, since we've been talking about this for such a long time, about 80% of people are either asymptomatic or have very light infections. They do not need to go to the hospital. About 20% of the population, or 16% of the population, need to be hospitalized, and then about 4 to 5% are actually needing to be put into intensive care units, and many of them then need to be on ventilators. We've heard a lot about ventilators and the lack of ventilators, or the concern about the lack of ventilators for those who are needing them. The way this virus strikes is it causes a severe acute respiratory syndrome. That's where SARS comes from. And what is needed is to push oxygen into the lungs because they do not have the strength or the capability of moving the oxygen by themselves. As we look at the capacity right now of our hospital system, there are about 861 COVID patients in the hospital right now. There have been about 103 of them discharged over the last 24 hours. Of the hospitals that are reporting, and we have over 100 hospitals in Colorado, but only 82% of them have reported. But of those reporting, 3 of the hospitals reporting anticipate that within the next 10 days, they will have a staffing shortage. 18% of them anticipate that they will have a shortage of personal protective equipment, and 2% of them, actually those aren't percentages. 2 hospitals say that they will not have ICU bed capability, 18 say they will not have personal protective equipment, and 3 are anticipating shortages in staffing. One of the things that we hope to have in place is that they, as I mentioned, that the hospitals are prepared to treat them. For the most part, we believe that the hospital system is prepared, although, as I just mentioned, there are some that are concerned, particularly over the lack of personal protective equipment for their staff. The fourth item that we look at as a trigger for opening up the economy is, have we seen a decrease in the number of cases that we have in the community over the last 14 days? We choose 14 days because that is the average incubation period of COVID-19. So if we can see a decreasing rates each day for 14 days, it gives us a good sense that the population really is seeing a decrease overall in the cases. Unfortunately, in Jefferson County right now, we do not have the testing capability that we would like to have. nor have we seen the cases decreasing over the last 14 days. There are some places where they have been able to do that. As the governor mentioned today, Eagle County, particularly because their community hospital bought all of the testing that was needed for the community, have been able to do testing and case follow-up contact tracing, and also have seen a decrease in the number of cases over the last 14 days. What we are trying to determine now, working both with Tri-County Health Department, which I know also shares a part of Westminster, as well as Boulder, Broomfield, and Denver, is looking at what are the kinds of things we might be able to do to loosen up the restrictions, even though we have not yet met all of the trigger points that we were hoping to meet. So that is what we spent the evening just before I got on this phone call talking about that. We have our attorneys looking at that. We're going to have more discussions tomorrow. We would love to be able to open up like Eagle County is, but as I'm sure you all heard the governor say, each county is a different county and may not be able to do all of the things that Eagle County is able to do. But we hope that we can at least begin to open up soon after April 27 or May 4, so that we can again get the economy headed back in the right direction. That's kind of an overview of where we are. I'm sure you've got some questions, particularly around the governor's announcement today, but I am happy to stay on to answer any questions that you may have at this point. I also appreciate, Don, your invitation to stay on till the end of the meeting. But if it's all right with you, I'll answer questions and then go have dinner with my wife.
Well, thank Dr. Johnson. This is Mayor Anson. You and I were on a call on Friday afternoon, and what we discussed were some of the things that, as you alluded to in your conversation, some of the shortfalls that we have with being able to get enough information. We specifically talked about the lack of reagent, test kits, staff that's qualified to do the testing, and then the labs to be able to process them in a number, sufficient in a number to start to figure out if we have a control on the virus or not. Based on the conversation that the governor had with us this afternoon, or actually earlier today, in the graphs that he showed, those numbers with the 35 all the way to 65% of social distancing still show a huge amount of need to get a great deal of expanded testing. And as you indicated in his conversation this afternoon, he indicated, as you did, that this will be a county by county decision of what gets open, what doesn't get open, depending on what the parameters are that we're trying to hit with the triggers. So we could see potentially a difference between one county and another that Westminster shares, just because with the testing results and the information you are still needing to get your triggers. There is another call that the governor has tomorrow afternoon with the metro area mayors, where we'll be able to ask more pointed questions since we did not get a chance to in the meeting we had with him earlier today. But some of the things that we're going to be looking at is what are the triggers for him to use to allow counties to have different opening parameters, and understanding that he plans to let the current order expire on the 27th. Will he be issuing another revised order that lays out some of these parameters in more specific terms, so we're not guessing as we had been in the past, especially when we had a difference between one major city and the governor's office on what was open, wasn't open. That caused a lot of confusion for our health departments. And we're hoping that he'll clarify that so that you guys, when you're making your decision, will have very clear directions on what he wants to expect out of you. We do have a couple of questions. Dr. Johnson, if you will abide with us for a few minutes, I'd like to turn to Councilor DeMott. You have a question.
Yes, thank you, Mr. Mayor, and thank you, Doctor, for joining us tonight with very useful information. I just have a couple of questions, and these are probably going to be to the best of our ability to guess. But when we talk about testing and the amount of people infected and hospitalized and all that, I've heard a lot of talk through all the different professionals and stuff that we hear on the news and through the governor and stuff about people who are the asymptomatic or the ones that aren't sick enough to go to the doctor who aren't getting tested. Do we take that into account when we come up with the calculations of how many people are in hospital? I mean, I know that's kind of a guess, but it seems like we are in a big realm of guessing, unfortunately, with the amount of testing we're doing. And I'm just curious how that plays into our modeling and how we anticipate, bed use and all the different things that you kind of went through as our trigger points.
Thank you, Councillor DeMott and Mayor Atchison. The asymptomatics, if you listen to the governor's presentation today, Dr. Hurley, he talked about how the fact that we have had about 10,000 cases in the state, we don't really believe that number. We think it's probably closer to 50,000 to maybe 65,000. As we look at the results from other countries and other states that have had this and have had better testing capability, they have found that the majority of the cases, or the majority of people who have had the disease, have not had symptoms. And so those are what we are calling asymptomatics. The problem with asymptomatics is that they can still spread the disease, and so can those who become symptomatic after about 2 or 3 days of being asymptomatic. That's one of the big reasons why we want to be able to test, is to find out really what is the background population in our community that already have had the disease, that tells us with a better precision exactly what we are facing now. The question as to what to do about that is rather complicated, because asymptomatic, for the most part, will not end up in the hospital. So it doesn't impact so much the hospital bed use. It impacts more, are we building towards what we call herd immunity, to a level of a population that has been exposed to an infection to such a degree that the infection has a hard time spreading through the population because so many people are immune. One of the complexities about that is we do not know how long the immunity to this disease lasts. There have been case reports from China where people who have tested positive for this and have had symptoms have been reinfected or have been infected again. We don't know if that is truly a reinfection or if it's just the infection manifesting itself again. We don't know from our studies whether the fact that you have antibodies is going to make you immune, or how long that will make you immune. So there are a myriad of problems with the testing, both for us to know, to surveil across the population who has had it, how sick have they been, are they continuing to be contagious or not, and even with the serological tests that look for the antibodies, we only have 4 so far that have been approved by the FDA. They are not well represented in the population. They're not out here very much yet. So most of the serological tests that we have, or many of the ones that we have in the community right now, are those that have not been approved yet by the FDA, and some of them have not been approved by the equivalent Chinese FDA. So we do not know how well they tell us what's going on. We've heard that some of them actually may be 20 to 40% reliable, which again, you cannot use that kind of reliability to tell you what's going on. So testing is a huge embarrassment and a huge frustration for all of us in this country, and is a major problem. I wanted also to address something that Mayor Atchison said, and that was that you do have 2 different counties that you are dealing with, at least 2. I'm not sure if you go all the way up into Weld County or not in Westminster, but at least in the metro area, Adams County and Jefferson County, we're working close to try to make sure that whatever restrictions we have that continue after the governor's order will be the same. Also, in addressing that, counties do have the power to have restrictions that are more restrictive than the state. We can just not be less restrictive than the state. So even if the state is to take off their stay-at-home order, the counties could decide that because of the situation we have in the Denver metro area, we do not want to let up the restrictions as much as the governor is in his statewide ban or statewide restriction, that we may actually need to continue to do something, but we do have that power at local health departments to do something that is more strict than what the governor is doing. We would love to not have to do that. And so we're looking at, are there ways that we can continue to monitor what's going on without the testing that's needed? Are there other surveillance methods that we might be able to use? What can we do to try to help open the economy as quickly as we can, but maintain the public safety?
Real quickly, since you're on the testing, my only other question that I had for you, Doctor, was along the testing, and you kind of alluded to it with us being a split county, and we are Adams and Jefferson County. I'm just curious if we have any idea how affected the actual city of Westminster is in that testing, or is it just all of Jefferson County when you talk about Jefferson County, or do you have an idea of how that affects the actual separate municipalities? I think most of our healthcare facilities probably are actually in Adams County as far as the city of Westminster, but I don't know if there's any way to track that. And the other quick thing is, do you know when there's been a big talk about drive for people giving blood, is there any indicators when people go give blood to see if maybe they were an asymptomatic person? And is that a level of testing that somehow is being done during this whole crisis? And again, thank you for your time. And that's the last question I have, Mr. Mayor.
Thank you.
You did.
Thank you again, Councilor DeMott. As far as the number of cases that you have in Westminster, I do not have that here. We do have that information, though, available. I just don't have it on my fingertips right now. I should have gotten that for you tonight. I'm sorry I didn't. But we do have cases by zip code anyway, and can help show the areas where cases are coming from. Would have to look both at Tri-County's data and our data to come up with that. As far as the blood drive, it is absolutely true that we are trying to get blood from those who have recovered from the disease, because they do have, hopefully do have antibodies, and that you can actually concentrate the antibodies and give the plasma or the antibodies to somebody who is severely ill. And there have been some case reports that has been very helpful in certain areas or in certain patients. You probably wouldn't, I honestly don't know the answer, that if you just walked in and said, I'm a citizen and I want to donate blood, and then I want you to check to see if I have any antibodies. I don't know if the blood banks have the testing capability to look for that, but I would guess that they do. But it would be more likely that they want people who have tested positive, who have now recovered, because then they know that they should have those antibodies and would be able to use those in what's called convalescent plasma therapy. Thank you.
Thanks, Dr. Johnson. Ms. Seitz?
Thank you, Mr. Mayor. And I'll be a little more brief because Dr. Johnson has answered a couple of my questions already. The first was, I wanted to know if, without us meeting these triggers, is there the possibility that the Jefferson County Health Department orders orders extend past that of the governor? And if I heard correctly, that is a possibility that has not been ruled out. Is that correct, Dr. Johnson?
That is correct, Councilmember Seitz, that we anticipate that we will not be able to do what Eagle County is doing and open up as widely as they are going to be able to once, if it sounds like the state health department says that they can do that. We also have heard that Denver is looking at extending the stay-at-home order. I don't know if the mayor is going to do that or not, but they have had some recommendations to do that. We're kind of trying to balance. We would love to do what, again, we'd like to have all of the Denver metro area be on the same page, because it decreases confusion and increases credibility. But we might be able to do some opening up, but not as wide as some of the other areas in the state are able to, basically because when you live in Hinsdale County and you have only 1,000 people or less living in Lake City, you can do things that you can't do in a metropolitan area. So I think that was one of the issues that the governor was trying to look at as he weighed loosening up the statewide order, but also saying that counties may have to continue to do some things because of the unique situations in the counties.
So I think it's going to be incumbent upon all of us as elected officials to make sure that we're doing expectation management with our residents to that effect. My second question, I think you also have already answered, which is basically, will you make every effort to work with Adams County and Tri-County Health so that if there was an extension, it would mirror in both counties? And I've heard you loud and clear multiple times say, yes, that is the case. So we can skip that one. So I appreciate you being so on top. I wanted to go over some of the numbers that you mentioned. I think you said out of the 82 reporting hospitals, there were 18 that were fearful of running out of PPE. I think 2 that were getting close to being out of beyond ICU bed capacity, and 3 that were looking at staff shortages. Do we know if any of those are within Jefferson County?
I do not know whether they are in Jefferson County. I would guess that at least 1 or 2 of them, with the concerns about personal protective equipment, we have heard from both of the hospitals in Jefferson County that they are concerned about that. I do not know about their staffing concerns or the ICU beds at this particular time. I know one of the ones is, I do know that the Medical Center for the Rockies up in Loveland has had some ICU. They're full, but I don't know about the other one in the state. And it could be that our hospitals are also some that did not report. So I don't know exactly which hospitals.
And Dr.
Okay.
Johnson, I can cover that at the moment for the 4 hospitals that serve Westminster.
You did.
Does that answer your question, Ms. Sykes?
Oh, okay. No, it does not. So my last little question, and this is on Jeffco specifically. I was wondering if you know ICU bed capacity, the number of ventilators in Jeffco. And then I know one of the factors that we kept hearing about early on was the R naught factor for COVID-19 being around 3 or 4 and really needing to get that closer to 1. Do we have any way to tell, and my guess is not without testing, if we're doing a better job of getting closer to 1 or below 1?
We don't have absolute proof of that, but we do have some indications that make us feel we are moving down from the 3.5 or 3.5 R naught that we had originally, getting closer to the 1. I did hear some reports that there are some counties that believe they are just barely above the R1. You may have heard today that New York feels that they are getting close to that R naught of 1. So I think we're moving in the right direction, but I do not have the totals for Jefferson County or for Adams County as far as that goes. The question about, yeah, go ahead.
Oh, no.
You did.
I'm sorry. When someone is speaking and my computer says muted and unmuted, and I don't always hear the question. Was there a question for me?
No, there was not. I apologize for interrupting you. If you want to complete my other portions of that question.
If you could repeat it. I know it had to do with ICU beds, but I don't remember exactly what it was.
I was wondering how many ICU beds we have in Jefferson County, and then if you know roughly how many ventilators we have.
I do not know how many ICU beds we have in Jefferson County. I actually looked at that number yesterday. It seemed like there were about 76 or so at St. Anthony's Hospital, and that Lutheran Hospital had about 40 some. But please don't quote me on those. And I know you should never tell an elected official a number you don't know. And
I will not quote you.
as far as the ventilators, I have not heard that we have a shortage yet in Jefferson County of ventilators, but I do not know the number of what we have.
Thank you. And then my final question, there's been some comparisons to COVID-19 and the Spanish flu, and specifically how the Spanish flu had a second wave, and the peak deaths during that second wave were significantly higher than the first wave. And so as a public health officer, do you have advice? What can our residents do to make sure they're practicing best behavior, best hygiene, to prevent us from losing all of the ground we've gained?
Yes, thank you again. That's an excellent question. And that's probably the thing we worry the most about in public health is, well, the first was not overwhelming the system, trying to flatten the curve. The second is trying to keep any sort of a secondary peak as low as possible, or if possible, not even have that. The message is a very difficult one to get across to people, and that is that the reason we have put such strict regulations in place, the stay at home and closing restaurants and bars and businesses, all of that has been done to try to keep both of those things under control. The overwhelming of the hospitals and now letting up too quickly is what we are concerned about. In the 1918 flu epidemic in Denver particularly, there is a good graph that shows that they were making good progress. The number of cases were going down. They then took off the school closure and some of the distancing regulations, restrictions that were in place, and they ended up with a higher second wave. So what we're trying to tell the people, the residents of Jefferson County and the whole state is, it may hurt now, but it will hurt a whole lot more if we let up too early and then have higher waves of death and disease and have to put restrictions back in place again. So what we're trying to do is balance that and keep those numbers going down. That's why the Colorado Association of Local Public Health Officials put together a chart as to how we could slowly in tiers begin to let up on the restrictions, and then also have in place markers that would show us if the cases were beginning to start up again, where we could quickly move back into a more restrictive area so that we don't see that second wave come up. So I guess the message that we're trying to sell to everybody is, we know it hurts now. We don't like it either. We would love to see these restrictions raised, but we know that if we do have a second wave, it can be just as deadly, if not deadlier, and it will be much harder to put restrictions back in place once we've let things up and people have felt like they can get back to normal.
Ms. Stites, does that cover your questions?
It does. Dr. Johnson, thank you so much for being here tonight. I appreciate your time.
Thank you.
Mr. Seymour, you have a question.
Thank you, Mr. Mayor. Dr. Johnson, you did mention in the reporting update that 82% of the hospitals were reporting. Is that a frustration point, or is just on that particular report that's the only number that you were able to gather?
It's actually a study that the Colorado Hospital Association puts together on a daily basis. And some days they have 90-some% reporting, some days they have less, but the most recent report was only 82% of the hospitals reporting. It's not necessarily a frustration point, it just means that our data is incomplete.
Thank you. And then your number using the projected 55,000 to 60,000 that you may be infected, and then looking at the death rate currently of 420, so that gives us a 0.76% death rate to infection. Is that correct?
if those were the actual numbers, yes, and I can't quickly do in my head the percentage, but I think you're probably close. We are anticipating the death rate will be somewhere around 1%. But again, we can't tell until we do those tests. Those, that's a huge spread, 50,000 to 65,000. So that's why we would love to know exactly what is the population, and that's something that we're going to be doing over the next year or more, is testing the population and finding out, okay, who was asymptomatic, who were those that actually had the disease, but we don't know, because that does decrease the death rate based on your cases. So right now, we don't have that we don't have a denominator for basing any of those rates on, because we truly don't know. It's a speculation based on the fact of what we've seen in some of the other countries, that about 80% of the ones who get the disease will not be symptomatic or not be so symptomatic that they end up being tested. But that's something that really is a limit of our inability to test right now.
Thank you, Dr. Johnson. Appreciate it.
Thank you, Councilman
Are there
Seymour.
other questions from the council at this time? Just to respond to one of the questions that were asked, because Westminster is served by 4 hospital groups, being Health One, SCL, Avista, and Centura, we have a weekly meeting with those, and it's close of business on Friday. None of their ICU units are full. I don't have a number that they gave, and Barbara, I don't know if you recall or not, that the number of ventilators, none of them were out of ventilators at that point. But right now, unless something has changed since earlier this morning, none of the 4 hospitals that we typically take patients to, or Westminster residents typically go to, are indicating that they are out of ICU beds. Ms. Scully, you had a question? Catherine, you may be muted.
Can you hear me now, sir?
Yeah, we can now.
Okay. So I have a question about the homeless and their containment. How are we planning to progress with that? And with the safer at home rather than the stay at home, do we have facilities in Jeffco that we're going to be able to open up for the homeless? And have we given any thought to that?
Thank you, Councilmember Scully. We have given a lot of thought to that. Much of the work has been done by the Jeffco Department of Human Services, working with us and with the Emergency Operations Center. We have contracted with a hotel motel in the area for up to 25 beds for the homeless who may end up needing to be isolated away from a hospital, but also have a place where they can stay. We have also put together some encampment teams that are going out to homeless encampments and trying to bring items that they can use for hygiene, talk to them about issues, that sort of do a quick triage as to how they are doing. Try to get those who may need to be seen into a healthcare facility where they can be seen. And also, we are working with our law enforcement to try to, at least during this period of time, cut down on any sweeps through this area, because right now it's better for them to sort of stay where they are than to have them disrupted and moving around. So we are working both with human services and with law enforcement and with the county manager and others to try to prepare for those who we know are going to have some problems in that population. Probably not, I don't know if that'll be enough. From our modeling, we think between 25 and 40 may need to have some non-congregate care facilities. And as I said, we have reached out to a contract for at least 25 rooms for that.
Thank you very much, Dr. Johnson.
Thank you.
Are there any last minute questions of the council? I know Dr. Johnson indicated he'd like to get to his family. Dr. Johnson, I don't see any new questions, and I do again appreciate your time. I know you and I have been on a lot of calls together over the last few weeks, and I appreciate the leadership that you have given us here in Jefferson County and the city of Westminster as well.
Unmuted.
Thank you very much, Mayor, and thanks to all of you for the work that you are doing. This is a difficult time to be in government because we're having to make some really hard decisions, and I admire all of you. Thank you.
Mr. Tripp, you want to continue on with the EOC updates then?
Yes, thank you, Mr. Mayor. We're going to spin now to Max Kirschbaum, who's going to lead us in first a presentation, then a discussion and answering questions concerning reopening our city. And, you know, the community and the city is both the business community and the services that we provide as a community. We have many things that continued because of the critical nature of those responsibilities, but we have some things closed. I would tell you that I think what city government does provides leadership in the overall community as to how we, as a policy matter, handle this. And so on your behalf, you know, that's my responsibility. And to do that properly and to do that with the kind of feedback that's necessary, I want to have a dialogue with you tonight through Max Kirschbaum and our EOC. Tonight, our goal would be to leave with some direction, because we are getting closer to stay-at-home orders being removed. We don't know for certain what will happen in our two counties. We know what the governor's input is today, but Max Kirschbaum and the EOC have been working with the department heads, with people who within the organization and managed facilities to provide to you tonight a report on what the conditions are that we believe that are necessary to reopen municipal facilities in Westminster. I would close by saying that the theme that you'll see will relate to a metaphor that's good for Max to have, and that is, you know, we're cracking the valve, not opening the valve up full way. And I just want to say that when people hear that the order is lifted off, you know, some people will probably be assuming that we're going to open back up on Monday. That's not the case. We're not ready to do that. But we do need to have a discussion tonight so we can come in tomorrow and really roll our sleeves up and start to apply these conditions. So with that, Max, if you would go ahead and take it from here.
Thank you, Don. Before I go through the couple of slides that I have prepared for you this evening, Council, I can answer one of the questions that was asked of Dr. Johnson in terms of number of cases that have tested positive in the city of Westminster. On our situation report that we provide to City Council 3 times a week, we aggregate the Westminster portion from the Adams County and the Jefferson County reports from the public health agencies, and that current case count for Westminster in sum is 148 cases as of today that are confirmed positives. The remarks I'm going to make this evening actually follow on quite well with Dr. Johnson's discussion about the triggers that they're looking at from a medical perspective. So I have 2 slides following this cover slide, and the purpose of this presentation tonight is just to discuss the policy statement and the conditions that would be necessary for us to begin the process of reopening city facilities. If I could have the next slide, please. Okay, so here you have the very simple policy statement that goes with our plan to reopen facilities, and that is simply stated to resume either normal or modified facility operations in a manner that maintains the health of city staff and the public against the spread of coronavirus. If we could go to the next slide, I'll go to the conditions. So Without getting into the detail that goes into specific facility plans and what we would call in the draft plan that we have basically ready to go, we call them practices within each of the facilities. I'd rather focus this presentation with you on the conditions that we feel that are necessary for us to begin that process of reopening facilities. First would be that the stay-at-home provision of Public Health Order 20-24 is lifted. And you got some words today from the governor, and Dr. Johnson also spoke to them. It looks like that would be in our near future. The second, similar to the medical triggers that Dr. Johnson spoke of, we'd like to see the number of confirmed cases statewide that are reported by the 2 public health agencies to be on the decline. We didn't put a specific number to it, but you heard Dr. Johnson say there is value and importance in a 14-day period of decline. The third of the conditions would be that specific facility plans are prepared and approved by the city manager. Fourth, Don mentioned a phrase to crack open the valve slowly. The point being that there would be a deliberate pace for reopening of facilities, and that it wouldn't occur at any facility until the operating methods are in fact sustainable over time. It doesn't do much good to open a facility and not have the supplies, equipment, or services to keep it that way. Next, linking closely to that is that the supporting businesses that the city relies upon to operate our facilities are functioning. Examples of those would be custodial, a flow of supplies, and as you might guess, there will be great competition for the basic supplies that any business or municipality might need, and that any other service providers that allow us to keep doors open have returned to business and are functioning. Next, the next 2 actually go together, so I'll just kind of address them at the same point, that there is both an adequate and sustainable supply of personal protective equipment for staff and the public as needed, as well as the cleaning and sanitizing products and services that our facilities would rely on in order to serve the public. And finally, the basic condition that we feel is necessary before this process of reopening begins is that the staff at each of our facilities is capable of properly enforcing the practices that we develop, both for coworkers as well as the public that we serve. At this point, I think I'll stop and see if there's any questions or feedback on these basic conditions. And again, the purpose is for us to finalize the plan that we will follow in developing those facility-specific plans to begin reopening facilities. Thank you. That's the end of my comments.
Thanks, Max. Council, at this time, are there any questions from the council in regards to the presentation that staff made? Mr. Demott.
Thank you, Mr. Mayor. So I know even like private companies, as well as what the governor was saying today, was even with the lifting and the counties and all the different things you guys have to take into account, is the city and the EOC looking at some specific measures in say like at City Hall, where you're going to kind of phase in and allow some people to keep working telecommute and some people coming back into City Hall, for example. And how is that kind of coming into our specific plans, and how you're going to kind of, to your point, crack the valve opposed to opening it all the way back up?
Thanks, Councilor Demott. Yes, in fact, I'll answer that in two ways. First, the plan that we are developing, as I said, would have a variety of very specific practices unique to each facility, but also we view the plan as being rolled out or being able to roll it out in phases so that we can continue where it makes sense to use work methods like work from home or a different shift schedule that would allow only a portion of people in a workspace at one time, those kinds of things. They will continue as we begin to reopen facilities. That's part of that plan of phasing back toward normal. So we would use all the practices that we're using today and continue to step through time and maybe relax or ease some of those restrictions as we go.
Great, that's very helpful. I guess, and this may be more of a question for the council to start talking about, but I'm curious, and even what recommendation, I guess, from a facility standpoint, where council may, what for meeting publicly, what are we looking at for us being allowed to start conducting business as we were before? And I'm not suggesting that we do that right away, but I'm just curious, as we do this as a city and stuff and facilities and everything, since you guys are in charge of that, what are kind of the measures and key goals for us to start doing those kind of things again, including like our boards and commissions? Is that something that we've started talking about as part of this process as well?
We're just now beginning to start discussion by specific facility. We've really spent the last 10 days or so working hard on just getting to this general set of conditions and the type of practices within a workspace. Clearly, City Hall is going to present one of the two largest challenges for us. The other probably being the courthouse in terms of the ability to handle visitors into the building and to conduct business. So I don't have a specific answer for you, but before this week is over, we'll begin looking specifically at City Hall and a group that will be led by Deputy City Manager Barbara Opie. In fact, we'll be looking at City Hall very specifically.
Great.
I'll weigh in on this a little bit that may help you. First of all, it's a two-step process. We've got to, from the conditions, figure out when City Hall can be open and under what sorts of conditions it can open. I think we can do that fairly soon, relative. But when we do that, then it's your meeting and they're your boards and commissions. And so I'd suggest that we would be coming back to you and maybe offering you some alternatives as to how that could also be staged in, but allow you to have that discussion, because I really think that's your decision, and we'll just try to provide you some options as to how we can make those meetings be as safe as possible, but continue their direct interactive model that we're used to having. So we'll be back to you.
That's great. That's kind of what I was hoping for, because obviously, like you said, we have the overall responsibility in deciding how those go forward, but your input is valuable to me. So I very much appreciate all the work that you guys are putting in on this and all the time and effort, and it's very important work. So I appreciate it, but that's all my questions. Thank you, Mr. Mayor.
Okay. Just a reminder.
Councilor DeMott.
Go ahead.
I'm sorry, Mr. Mayor. Councilor DeMott, City Attorney also reminded me that the comments by the governor today still includes a limitation on group size in a facility too. So that number, which I think is stated as 10 groups of 10, would clearly be a factor in conduct of city council meetings.
No, that's a very good point. I appreciate it. Thank you.
And just Max's point was what I was going to bring in is, regardless of what we plan without direction from the state and the county health departments, we still have some unknown factors as we take that planning, because those rulings from those groups still drive what we can do. And since the governor nor the counties, either one, have finalized their plans or what their trigger points are, we only know what we know today. Mr. Seymour, you had a question.
Thank you, Mr. Mayor. Max, you mentioned our support staff janitorial services and whether they're ready. Have we made a determination if they are ready or not, or is that just the first part of this plan this week?
At this point, the expectation is that they would be able to handle this workload. I'm sure there'll be a little bit of growing pains there too, because some of the sanitizing methods that are already being employed in the facilities that are presently occupied are a little bit more demanding and time consuming. And so that's why I listed it here, is that we really need to look at how we phase facilities in to make sure that we don't outstrip the capability of that service provider.
Excellent. Thank you.
Ms. Seitz?
Can you guys hear me?
Yes, go ahead.
I apologize. So I wanted to say thank you to Director Kirschbaum and to the entire team for putting this together. And I do know that City Manager Tripp started by saying, you know, and this does have policy implications to it. And so as far as doing a litmus test to see if we're getting it right, I would say this absolutely gets it right. I think we have a duty of care to both our employees, but also to our residents that would be interacting with us at any of our city sites. So thank you for the amount of thought and care. And I think that this list is comprehensive, and also I support it completely. I would ask if we're also prioritizing how we reopen. So we're making sure that the city services that are most critical to our residents are given, I guess, prioritization at maybe first in queue to figure out ways to reopen them. And those that are maybe nice to rather than have to are maybe put lower on the burner. Is that something a metric we're using to make determinations?
I think that's certainly one of the qualities that we're looking at as we assemble this list of where to start, what needs to be reopened first. And if City Hall happens to be one of those facilities, as I mentioned earlier, that would be one of the greatest challenges that we have, given that it houses most every department in the city, and we conduct a variety of kinds of business throughout the business day. But yes, I think the answer is priority will be, at least in part, dependent upon the services that are most critical.
Thank you for that. I do think that we have the added burden as government of setting example and walking the walk, or walking the talk rather. And I think Dr. Johnson's presentation really highlights the need for us to both implement all of these policies and conditions you detailed, but also serve as an example of how to do it for our public. So I appreciate your thought and care on this. I do not know if this is the right time to mention it. I had mentioned to City Manager Don Tripp that I hope that maybe, and this may not be the right time, as we're looking at increasing maybe Parks and Recs activities, if we could figure out some of the programming that's maybe virtual in nature that helps build community, kind of, you know, things like the Howl. I know a lot of our residents have been enjoying, and it's really been helping us to feel together. And we have such a creative Parks and Rec staff. I don't even know if we need to reopen facilities for them to help focus on community. And so just throwing that in as an aside.
Is that it, Ms. Sykes?
It is.
All right, Ms. Scully?
Thank you, Mr. Mayor. Thank you very much, Director Kirschbaum. This was an excellent presentation. You're obviously very quickly working on things, and I very much appreciate that. I loved what you said, that we are opening a crack and not swinging open the door. I think that's really important to remember, that this is going to give us some reprieve, but we've got to really be diligent in practicing social distancing and healthy habits. And for a long time, this is, as I believe Governor Polis put it, this is a marathon, and we are just settling into the first part of the race. As somebody who's run a marathon, I completely understood that statement, and it was noted and taken seriously. Some things that I noted that I didn't see in here, and they may not be, maybe this isn't the right time, I could be thinking too far forward, but I'm very concerned about the staff's comfort in returning to work and returning to working in buildings. This has been a really big conversation at my personal works area, and making sure that those who are not comfortable returning into an office building at this time are given that time to breathe and take in what they are comfortable with and adjust slowly back into the system. So I hope we will add that in here a little bit. And if you have something to say on that, you can address that too. But the other thing is that communication. I would like to see this up on the website, if we could get it up there, so that people know where we're at and what we're thinking, and they don't feel like we're just kind of not there yet. And in that communication, I think everybody needs a really big reminder of what social distancing looks like and how we practice health practices. You know, I'm one of those that did the extreme, that I haven't been out of my house in 4 weeks. And, you know, I'm not really sure. I'm feeling a little anxiety about how do I reintegrate back in. You know, I'm like, oh, I'm going to need a mask. I'm going to need gloves. I've got to up my hand washing, you know. Reminding us what that looks like and what we should be doing, I think would be very helpful. And finally, the one thing that you made a great comment about, how all of our services are really contained in our city hall. Maybe when all of this has passed, because I don't think we're there right now, but once this has all passed, maybe what we need to look at is spreading our services out among the community a little more. You know, after, I think it was after the Oklahoma bombings, my mom was a Fed, and she worked for the federal government, and at that time, they used to all be in one building. It was called the Fed Center. And then there was a building downtown also called the Federal Building. And after that bombing, they spread them throughout Denver and throughout the suburbs, because it was a way to make sure that things were not centralized. And I'm thinking that same kind of thinking might also apply here, that we can zone. You know, Dr. Johnson talked about circling zones, and Governor Polis talked about neighborhoods, that we might be able to identify neighborhoods and kind of block those off. Maybe it's the same type of thing in the city, that, you know, we can decentralize a little bit, and that way we can isolate when we need to reduce a service in one area while we keep the rest of it moving. So that's all future thought. I don't think it's stuff that probably applies to this, but I just wanted to bring it up. Thank you.
Ms. Smith?
I can answer the first couple parts of that. Yes, we're very much concerned about the staff portion of that reintroduction. The phasing of this plan that we have speaks to how they would be reintroduced, or some sort of split operation, all for the purpose of continuing to be concerned about health and safety. It's also what we meant by adequate and sustainable supply of PPE and sanitizing products, and being able to properly enforce the practices for everyone. So all of those are mentioned. In terms of communication, one part of our Emergency Operations Center team is dedicated to communication, both internal and external. They have a very detailed plan ready to launch. We were holding for the conclusion of this evening and the publishing of this reopening plan to begin to push out the messages both internally and externally. And for example, this kind of ties those two pieces together. One of the tools that they have already developed is a short video tutorial that guides people on how to properly put on and take off a face mask. So I think this team, we're thinking about these things pretty thoroughly. And I'll just use that as an opportunity to say, I've briefed you a couple of times on the EOC, but I've never really had an opportunity to say thank you to the literally few dozen people that are dedicated to working the 15 or so teams that are laid out within the EOC. You have to remember that very few of us actually have experience in actually working in a functioning emergency operations center. So this is very new to most of us. And I can say the teamwork and expertise is very commendable, and I'm very proud of what this group is doing for our city staff as well as for our public.
Thank you very much for that, Max. I really appreciate it. And a big thank you to the couple of dozen or many dozen people who are working on this. I know everybody's got their heart in it, and I really appreciate that. Thank you.
Okay, moving on to Ms. Smith.
Thank you, Mr. Mayor, and thank you, Director Kirschbaum. I realize just how delicate and hard this is from a staff level, being in the mix of coming up with conditions for my employer as well. So thank you to you and your staff to try and roll this out. I do have a few questions, and some are following and are piggybacking off of a couple counselors before me. So one of my questions and or concerns was that phased opening and what we would consider or define as the most important to reopen. So I would, and I believe it was Mayor Pro Tem Seitz that brought that up as far as what that looks like and how we would prioritize that. So I would hope that we would look at all of our services that we have throughout the city and make good judgment calls on that. I know I received a question this weekend about our small businesses can do takeout and provide adequate social distancing. So why can't we open up our libraries to provide, like if they order online or if they reserve online, can they come and pick them up and adhere to those social distancing practices? So it's things like that where I think we need to be mindful of as far as this phased opening. But then kind of jumping on to that, what do we define as adequate PPE? Is this what we are defining as medically rated? Are we waiting on bulk orders? Or is this what we've been mobilizing as a community to make masks for our first responders? They're cloth masks, not medically rated, but they are a mask that can help in keeping us all healthy. So what do we define as adequate? And with that, what is the timing of what we feel as an adequate number to be functional and be ready and sustainable for opening these phased approaches?
In terms of the PPE, I'll speak the general staff, not first responders. We've been dealing with this first responder issue since the beginning, and that will continue. So really, I'd rather focus my answer to your question is on the remainder of staff. Generally, what we're talking about in terms of PPE is a face mask, not an N95 type, but a face mask that just helps against the spread of the virus. But it will also include minor facility modifications that may also be equally necessary to provide that barrier. Just like you might see plexiglass at the grocery store, for example, we're looking at that same kind of issue at the primary customer care counters that are located throughout our facilities, and especially in numerous locations in City Hall. So that's what we mean by adequate. And of course, by sustainable, we will, again, upon the approval of this plan, we are going to begin trying to make some bulk purchases of both the PPE and the sanitizing products that would allow us to keep the doors open and not have to have a shortage cause us to take an action to close a facility. We have already obtained and distributed a significant number of non-N95 masks to the employees that are presently working as we speak today, and we are in full compliance across the city already with the mandatory wear of the mask, following a procedure that was written by our Human Resources Department. So we're on our way. The key will be to get some of those bulk purchases made and received.
Thank you. So the follow-up questions with that is what type of budget are we looking for these purchases, as we've been told they're necessary to keep us all healthy. So what is the budget as far as what this will take to get us in an appropriate amount to keep our staff safe and our residents safe? And is that already allotted for, I'm assuming, in reserves or anything else that we've already been looking at within our budget?
I'll start the answer to that, but I would ask through Don if I could have some assistance on what the budget may be. There, of course, there wasn't a budget developed for a situation like this, so it is part of the reserve question. I can say that we are one of the teams that works in the EOC is our finance team, and at this point to date we have spent about $175,000 on services, equipment, and supplies to function to date. But as we put these bulk purchases together, certainly it's going to drive that cost up, and we'll have to calculate that. Don, if I could ask for some additional assistance on that, I appreciate it.
Certainly, Max. As you said, it's an unanticipated expense, which is not necessarily unusual. You know, in our overall general fund budget of 130 or so million, and utility budget of 115 to 120 million. So we're accustomed to these kind of weaving and bobbing with these sorts of changes that come up throughout the year. I'd like to ask Chris Lindsay maybe to talk to us a little bit more about that, what his thinking is in terms of income and expense and how we're going to work our way through this. And Chris, you might also say that it is very possible that some of these expenses will be reimbursed.
Thanks, Don. This is Assistant City Manager Chris Lindsay, and Don went right for, I think, the best answers that we're tracking these expenses down to the penny and documenting them in the hopes they get reimbursed through FEMA or other means through the federal and state government in the future. Max did identify there is not a budget for the purchase of PPE at this moment. We're tracking those expenses. We haven't yet exceeded a budget line item where those have been applied this far. So we haven't come back to council to appropriate reserves or contingency. At the point where that happens, we will likely be back in front of city council to discuss appropriating from the contingency in the general fund.
Very good, thank you for that. Just a couple more questions. And this might be more directed to our city attorneys, Mr. Frankel, but once the order is lifted, does that mean that the emergency order that we put in place for the city needs to be lifted as well? Or is that a case-by-case basis? And then I think we've had a few questions over the week about what does the local charter look like? So once this order is lifted, does that mean it's up to counties then? Is it up to local charters? And when does local charter rule have effect as far as this reopening approach?
Mr. Tripp and I spoke this afternoon about that very issue about emergency orders. So I'd like to yield it back to Mr. Tripp to give you his thoughts on emergency order from the city.
So I'm going to be brief because I'll turn to our expert on emergency declaration, which is our city attorney. But it would be our intention that the emergency declaration would continue even into recovery because it offers certain advantages that are best for us to meet immediate needs. In terms of the charter and its relationship to Jeffco and Tri-County Health, Dave, you might explain that because they actually do have authority over our city as it comes to these orders. But Attorney Frankel, if you would, please.
Thanks, Don. So at the state level, there are two layers of orders that I think it's important to think about. The emergency declaration by the governor, and then the subsequent stay-at-home emergency public health orders that have been enacted by CDPHE. So my understanding is if the stay-at-home emergency public health orders are modified, that would continue on with an emergency declaration continuing from the governor. Locally, we have an emergency declaration that has a few benefits. First, it activated our Emergency Operations Center and our EPMS. The other thing that was accomplished by our local emergency declaration was potential eligibility for reimbursement from FEMA and the federal government. It also allows for us under our code to conduct emergency meetings if needed, and it allows for us to conduct remote meetings if needed. Those are all tied to the Declaration of Emergency that Council has ratified after the mayor's initial declaration on the 12th. I believe it was the following Monday, the 17th of March, when Council ratified the emergency declaration. So I think it's important to consider the state of emergency on a local level. It does have some consequences. Obviously, the other consequence is that if emergency regulations were promulgated by the city manager, those would then be brought forward to city council at the earliest practical time under our code. So whether a stay-at-home order is modified by the state and whether the local health departments enact their own emergency public health orders, we have yet to see. But if next week the state level order expires and the county health departments issue their own emergency public health orders, we would be subject to those through Adams County and Jefferson County.
Thank you for that explanation. And I think it's helpful for our residents to hear that as well. Because I know that there's lots of questions starting to come up about that. And then finally, as our conditions that we've laid out, I really truly believe in personal responsibility, and I hope it sounds like you've touched on this, Director Kirschbaum. But as far as the conditional pieces, I really would like to encourage staff to look at some educational pieces as far as keeping good hygiene and washing hands and covering face if that's the case, to really help keep down any kind of sickness. So I would appreciate some educational pieces to just remind people, it's I guess separating, social distancing, but making sure to really wash our hands, not touch our face. I think that really helps. Just keep it at the forefront of people's minds as far as keeping that proper hygiene. So thank you for your work. That's all my questions. And thank you for your time.
Mr. Vold, you're the only one I did not see
thank
that
you.
had a question in the first round. Do you have anything this time? Otherwise, I'm going to start back through the group again.
No, I'm good. Thank you, Mr. Mayor.
Okay, Mr. DeMott, you had a follow-up question.
A couple. Thank you, Mr. Mayor. First, I'm curious on the changes to the facility. You mentioned like the plexiglass, and I've seen different businesses doing that to protect the both the patrons as well as the employees. Are we trying to do those in such a way that they would be, permanent fixtures? Are we taking that into account, or is it a time and a place kind of thing? Trying to be forward thinking.
Thanks, Councilor DeMott. I think it might be a mix of those answers. Some of these areas may need and rely upon it for an indefinite future, and others, there may be other solutions that would make the plexiglass unnecessary, or that kind of sneeze guard or barrier as unnecessary. So I think you'll see a little bit of a mix. In some cases, I would expect to see what we put in stays up.
Great, thank you. Next on the PPE, and I know you've talked about this in quite a bit of length, but I'm just curious, and this may be just like a point of forward thinking, and it sounds like we're kind of doing that as we track it, but I'm wondering if we're down the road, once we're through this, reevaluating what we actually have on hand on a normal operating basis. God forbid we run into this sort of situation again. So that's kind of one point. But the other thing is, are we on a normal basis? And I know that my company donated some masks, and I was glad that they were able to do that. But is that something that we can look to the community if they have PPE to help protect, say, our first responders and stuff? And if so, how was that working? Are we just looking to just acquire them? And I thought through that after, my company had donated them, and we took them to, one of the stations and dropped them off to them. But then I've since seen, stations are closed. So I'm just curious what the actual right answer is in case we run into people who have good PPE that they could donate to the city.
First and foremost, we're relying on a purchasing program for a couple of reasons. One, we can assure wide distribution of a standard item. Therefore, it's easier to train to how to put on and take off that particular item. And we know of its origin and quality. Sometimes with the donated materials, it's difficult to know what the origin or the quality of it is. And if they're in small quantities, that uniformity becomes a minor issue. That being said, we have had a fairly active donation program, and those donations, for council's information, are also contained in the daily situation, or I should say the 3 times weekly situation report. If you look under the logistics section, you'll see an accounting of specific items that have been donated and accepted for use. And the method for that is simply they can be dropped off or received at a fire station.
Great. And since we're on the subject, thank you to all the people who have actually sewn them and donated them. I've seen countless different people, especially in our alumni group, that has done a lot of work to do the cloth masks that they've donated to different groups, including some to the city. So thank you to those folks if they're listening. I have 2 quick other things. One on the emergency ordinance, and a lot of my questions that I had emailed have actually kind of been answered. And so the one outstanding thing that I had emailed in that I was curious about when we did this action back a couple weeks ago, a couple things that I had raised. One was how often are we going to reevaluate? And I know that's kind of up to council. So I'd like us to be on some sort of cadence. And I understand all the points that were made by the different staff members, including our attorney, and why there's benefit to it. But I do, want to know how often we should reevaluate as we go into recovery. The other thing, quickly, so you could answer it, call it all at once. And then I have one other thing I want to mention is kind of the accounting, and there's different things that this gave leverage to the city manager to be able to do in this time so he could move quickly. From my understanding, some of that would have normally went through council. So I'm just curious, how that list is being accounted for, because that was one of the things I brought up that made me comfortable with us going into this situation. And I'm just curious on that point.
If I could answer that part first, and then I'd like to turn it back to Don to answer the question about intervals for reviewing the emergency order. Again, that's why we've really tried to work on this situation report to be not only a good record of everything done, but a good tool for informing council of the kind of record keeping and actions being taken. Also in that section ESF 7, there's a portion dedicated to finance. Today's report is a good example where you'll see the level of detail that we're going through to ensure that all of our record keeping from day one is FEMA compliant, so that if there is opportunity for public assistance and reimbursement, we're not worried about recreating anything. We've got the documentation ready to go.
Great, that's great. And I think that's important for the public to understand kind of how this process has went.
Don, did you have any follow-up on that?
I think Dave Frankel's going to jump in on this one.
Okay.
Thanks, Don. So yes, under the code, the emergency response powers are listed under 1-32-7. And during the state of emergency, the city manager is authorized to promulgate emergency regulations as needed. Those regulations get confirmed at the earliest practical time by the city council. As you'll recall, when the first emergency declaration was issued, it triggered action by both the Jefferson County and Tri-County health departments to draft their own emergency public health orders. And once those orders were issued, then the governor issued a statewide order. The consequence of the state order is that largely preempts local action unless a local jurisdiction has a basis to enact a more restrictive emergency public health order. This has occurred in Colorado. I believe Pitkin County, for example, closed all construction sites. They went above and beyond what was required of the state public health order to make more severe restrictions applicable locally. I'm not aware of our city adopting emergency regulations, but rather the important thing to look at for City Council oversight is under 132.6, which is entitled at paragraph C, the effect of the emergency declaration. Essentially provides that the City Council convenes to perform its legislative powers as the situation demands and shall receive reports through the city manager and evaluate and enact policy or other incident support as required. And I believe that reporting back has been occurring on an almost daily basis and in meetings like this one, as far as the efforts of the city to manage the crisis and ensure that we are providing continuity of operations for municipal services. So the other part of the question, as I understand it, is the duration. And the state of emergency is in effect until renewed by council, so it's under 132.6D. So the council did ratify the emergency declaration, I believe it was on March 17th, and then it's in effect until further notice. Council may by motion terminate a state of emergency at any time, and the city manager then would immediately issue a notice affecting the same. So the duration is really defined by City Council at this point as to when you believe it's appropriate to end. But I think that some of the considerations would, as I said earlier, go to the potential for reimbursement for FEMA funding for emergency expenditures, the state of our EOC, and whether we want our EOC to continue to operate, but also tools for council as far as your ability to, if you need to conduct an emergency meeting, or if you need to conduct remote meetings such as we're in now. Those tools are contingent on the state of emergency under the code currently.
And I appreciate that re-explanation, and I'll be honest, I understood all that. What I don't understand is the cadence of when we're going to say, okay, let's reevaluate. Hey, Mr. City Manager, are we still in that situation? And we've done that here tonight because we asked, but I guess my ask is that we have some sort of cadence that makes sense. If that's every 3 weeks, every 4 weeks, because we, unlike other cities where they have put a time on it, and then at that time, it sounds like they're reestablishing it, which I'm not saying I'm more comfortable with. I just want to know that we're going to have some sort of, and I do understand that we also are getting a lot of this reported to us on a pretty daily basis, and I appreciate that. But there still needs to be some sort of cadence where we're saying, okay, we're going to evaluate the state of being in this emergency declaration is really what I would like. And I understand how it works. So understanding that we're putting a lot of trust in City Manager Tripp to do his job and for his team to do what they're doing. I'm just looking to say, when does it make sense for us to have some sort of cadence on the conversation? And it could be we get to a month and we get to that cadence and we're saying we're still in need of this, to be in this status, and that's fine. I just want to know that we're going to have some sort of normal where we're asking the question, I guess, is my desire.
Of course, I'm happy to do that in whatever time frame you'd like. I can tell you that I won't be recommending to you to take it off until I'm certain that we are able to capture all of our expenses. For me, that's probably one of the main considerations. And at this point, I don't believe there's been anything where I exercised any authority, because nothing's come back in front of you. We'll report on that. I asked Dave if he would double check and make sure that is the case, but we'd have to come back and affirm that at the next meeting with you if I'd done something like instituted different sort of hours of public ability, curfews and things like that have happened, I think, some other places. But I'm happy to come back and on whatever interval would satisfy that.
I would think something like monthly, just to say, are we still there? I mean, and I totally get it, and I agree with what you're saying. I just want to know that we're, that it's just not left in place and until otherwise. You know what I mean? I just think it makes sense for us to be asking the question on some sort of regular interval. So, you know, I defer to the rest of council if they want to jump in and ask for that. That would be my desire, but obviously it takes 3 more of us to make that decision. The last thing that I would mention, there's been a lot of talk from council as far as walking the walk and, you know, doing the right thing and personal accountability. And I know through the videos and things that we've done of that nature, I think this whole council agrees that, you know, we are asking people to make smart choices. The other thing that I would ask, you know, residents as you go through this right now, there's been a lot of different protests across the country and things of that nature. And, you know, a lot of name calling and stuff back and forth, which I find unfortunate. You know, I would ask people to put yourself in your neighbor's shoes right now. A lot of people are in horrible situations where their livelihood is at risk. And, you know, I think it's unfortunate that we're like us versus them in some scenarios. I think we need to remind ourselves that we're all in this together. There are people who are just trying to figure out how they're going to make a living. There's people who are trying to figure out how they're just going to stay safe because they're in risk demographics. So, you know, I would just ask everybody to really think about your neighbors' situations, because it's not the same, you know, for all of us. Some of us are lucky enough that we're still getting a paycheck, and we can shelter in place and not have to worry about it. We don't all have that benefit, unfortunately. So, you know, just my message out to people, you know, keep being safe and, you know, doing the smart things, but also be cognizant that we're not all in the same situation.
Is that it, Mr. DeMont?
Yes, sir. Thank you.
Okay, Ms. Seitz.
Thank you, Mr. Mayor. And this is a question, I guess, almost more for Councilor DeMont. First off, thank you for that reminder. I do think it's important for everybody to maybe take the politics out of things and the positional nature of things, and really have I think deep empathy for each other right now, because all of us are facing this. While we're all in it together, it's impacting us each differently. But I wanted to ask Councilor DeMont if perhaps rather than having us reevaluate at a certain interval, if he would consider it at a certain trigger, because it doesn't seem necessary to even consider it if we aren't able to make, you know, have in-person meetings yet, correct? Like, so if it's prior to us being able to leave the virtual center, obviously we're not going to support ending the emergency ordinance. So I was wondering if we could come up similar to what the health department was talking about, or even the state earlier today,
Yeah,
triggers that might be.
No, I think that's a fantastic idea, honestly. And I would even, you know, direct it back like to City Manager Tripp if he thought he had a appropriate trigger that says, you know, here's the point. We you know, get all our FEMA money or whatever it is. But I think that is a reasonable way to evaluate.
Right. And radical empathy is what I was searching for, but couldn't think of. I think we need to practice radical empathy.
Agreed.
I've had a good suggestion from one of the deputies about putting it on the first study session of each month as an agenda item. So it's there. That's really easy to do. No qualms whatsoever about that.
I appreciate it.
Ms. Seitz, anything else?
That is it, Mr. Mayor.
Okay. Last call on this item for the council. Is there anyone else that have a question or comments? And if not, we'll move on to the next item on the agenda. Mr. Tripp, do you have anything else to wrap up on this?
I don't. You can go ahead and proceed through the agenda. I think our staff is all queued up, Mayor.
All right, thank you. All right, going on to a number of the council, I think about half of you were on the call we did this morning with the Westminster Chamber. So some of, unfortunately for you, you're going to get to hear some of it again. We talked about on the chamber call this morning some of the things that are affecting us both nationally and here at the state level. So I'll try to go through those and not dwell on this too long. As we recall, the SBA PPP program was funded at $349 billion. That original funding has now been exhausted and is no longer being accepted as of the 16th of this month. However, this morning at the state level on the unemployment basis, the 1099 and independent contractors can now apply for funding through the state unemployment basis, which has never been done before because they don't typically fund independent contractors and 1099s. But that is available to our workforce today and our citizens as well. As we talked about earlier this last week, the Colorado Legal Services Group, which supports a lot of our people in need in regards to evictions, other things that help to do with their housing needs, reported last week that they are experiencing 40% of a normal caseload call-in, and they are not able to explain why that has dropped off so much, but it could be just that people are not thinking about it. The other part of that was that most people who had paychecks in the first part of April were those that got them for work they performed in the month of March, or their employers tried to carry them over. So they may see a uptick around the first part of May to the middle of May, when people really start to figure out that they don't have that second paycheck in March coming in, or April, I'm sorry, that they'll start to see that more of an uptick in May. One of the things we talked about on the call this morning was that we have confirmed, and actually John Hall and I met with this group late last week, the vacated hospital site that was originally an SCL facility at Church Ranch and Westminster Boulevard is now under lease to a new organization that will be coming into Colorado for their first venture, and Westminster will be their first site. The intent is to reopen that facility as a medical facility, employing about 100 to 150 employees, and they're expecting to open up that facility in around the fourth quarter of this year. One of the things that we also provided an update on was the Metro Mayor's initiative on the small business assistance, and this is based upon all the municipalities, did not include counties, it's just municipalities. That as of this morning, the municipalities have raised in excess of $19 million to support either through loans or grants, depending upon the city, because each one's a little bit different, for helping to get businesses to get through this initial phase until they can get through into the federal grant programs. The governor talked about in a meeting he had this morning and in a press conference this afternoon, and the Metro Mayors has another meeting with him tomorrow, in what is going to happen with the stay-at-home order. He has currently indicated that he's going to let the one on April the 27th expire. However, he has not given any indication of what his expiration order will actually contain as to what restrictions will stay in place. And this is what Dr. Johnson was kind of alluding to, is we need the state to give us the directions before the counties can finalize theirs, which then will be promulgated down to the municipalities. There's a good chance we'll see most of that start to trickle in by the end of this week. Hopefully we'll be able to get that promulgated down to the city level as to what restrictions we will still have to do before the staff has to make any major decisions. One of the things we talked about on the call this morning too is the amount of scams that are currently being seen. We've seen it here in the city as well, of emails going out asking for people to get cards. They're being perceived to be people in need. What I would ask the general public is look very carefully at any email that is asking you to send money to anybody or into any organization to make sure that you can confirm that these are legitimate. Myself, that happened to me yesterday and today. We've taken action here at the city to try to figure out where that's coming from. The police department has that turned over, but we're not the only ones that people are using other people's names to try to solicit funds. And again, especially our elderly may not be looking at this close enough. So please check your emails, make sure you understand where it's coming from and that you can validate that this is a legitimate expense that someone is asking you to expend money on. The other question that's been raised has been to deal with the perception of the hospital. The report that came out from the governor's press conference identified St. Anthony North. St. Anthony North has two hospitals under one license, but it is only referred to as the facility at 144th and I-25. The other facility is at 84th and Federal, which is the St. Anthony 84th Avenue campus. That site is under the control of the Corps of Engineers in the state of Colorado. We've been asked by people who are wanting to know why the city is allowing this, and it's very simple. This is a federal mandate, and the city does not have any options on this issue. It's just under part of the declared War Powers Act and under the federal emergency that's been granted to the state. This is a facility that was formerly a hospital, that has been closed for several years, and the Corps of Engineers has executed a mandated lease with Centura for that space. They intend to reopen it as a surge facility. As of last Thursday, as I reported this morning to the chamber, they have not started construction on that, but their lease takes effect on May the 1st. Now, what we've been told through various avenues, that the first groups that will be coming into there are people who are currently residing in nursing homes, where there is a concern about the ability of those facilities to properly care for these elderly people and those who are sick. We do not have confirmation other than what's been reported, and we'll try to keep monitoring that. But again, this action is outside of the control of the city. We are following federal mandates, and we will try to keep as much information, but at the present time, we have not directly had any contact from staff or myself, Corps of Engineers, with anybody representing the state on this. And so far, they have been reluctant to give us direct access into the Corps because they don't want all the people who are not involved starting to give them calls. The staff will provide us information as we can get it, and we are trying to get as much information as we can, but we're just not getting it right now. Again, the governor's stay-at-home order was pretty specific that it will expire this later this week, but we will wait for further direction. The other piece that we talked about on the call this morning was the Westminster RISE program, which opened on April the 13th and closed on the evening of the 14th. The council has this information, but for the public, let me give you a small amount of information that was provided by John Hall, our Director of Economic Development, and Don Tripp, our City Manager. On Monday, April the 13th at 8 a.m., the city's Economic Development Department opened applications for the Westy RISE Business Grant Program. In the first hour, just under 100 applications were received. Because of the extraordinary response, the acceptance of new applications for grant assistance was closed Tuesday night, April 14th, with over 400 applications having been submitted. Beginning Wednesday morning, a team from Economic Development with support from Finance and Policy and Budget began reviewing and processing applications. Applications are being evaluated against program criteria and reviewed for status related to being in good standing with the city and the Secretary of State. By close of business Friday, April 17th, 160 applications had been reviewed against the program criteria. 48 of the 160 have also been reviewed related to their good standing status and have been approved for a grant award with check issuance beginning today, Monday, April the 20th. Award notifications will occur by both email and letter. They will also be going out Monday, April the 20th. Staff anticipates reviewing approximately 50 applications per day for the remainder of the week, with award notices and checks going out to approved businesses throughout this week and into next week. The goal is to have all applications reviewed, processed, and notifications sent out by the end of April. Mr. Tripp, I'd like to turn to John Hall to see if he has anything else he'd like to add on that item at this time.
Thank you, Mayor and Council. This is John Hall, Economic Development Director for the city. We have been fairly true to those numbers today, processing more applications. A genuine thanks to our business community for hanging in there during this very difficult time, and to our staff for going above and beyond to help out our local businesses. I'm happy to answer any questions, but we are working around the clock to try and satisfy, to the extent that we can, the demand that's been demonstrated through this program.
Are there any questions on this item for Mr. Hall at this time? If not, I'll go ahead and turn it over to Mr. Dorr. Would you bring us up to date on the financial items?
Thank you, Mayor, members of the City Council. Larry Dorr speaking, Chief Financial Officer. And you'll see under my report, under number 3, I had a few comments on Westy RISE, and I would like to go ahead and just close that out now by adding just one more detail that I got from the Finance Department a little after 5 o'clock this evening. and that is that the Finance Department has dispersed 36 checks today in the amount of $178,000 that have gone out to Westminster businesses under Westy Rise. So this is just really hot off the presses, and wanted to share that with you, and also just share my kudos and appreciation to the economic development staff and finance staff for working over the weekend and meeting each day on all of the many logistics that have gone into Westy Rise. So if you would just kindly cross off number 3 on my reports, I'll just proceed from the top. But I felt that that was a really good amount of funds dispersed and demonstrates us advancing on the program and investing in recovery. Well, thank you. My report, follows under the umbrella of financial sustainability and economic resilience. This is what we're trying to achieve at the front, and hope that we will be able to maintain services to the community and maintain Westminster's quality of life. A function of that is obviously maintaining our workforce and keeping those services engaged for the public. Relative to that, in my previous reports, I've described the city's general reserves, and I've described the city's revenue stabilization reserves. And, obviously this COVID-19 is creating quite an impact to the city's revenue collections, particularly sales tax. And so it would be logical to utilize the revenue stabilization reserve to backfill these lost revenues. However, beyond that, and should these be needed, I've described that the city has cash-funded projects that we are undergoing an evaluation to determine implementation dates, schedules, all of the logistics that go into these capital projects, so that we could prepare them for presentation should it be needed to defer or delete some of these projects. But in advance of that, it makes sense to get feedback and have a bit of a dialogue with you, council, on these capital prioritization guiding principles. And you'll see them here on the slide. I won't read them aloud. They're self-explanatory in many cases, and I'd be happy to answer any questions on them or engage in any discussion. And then there are some other considerations beyond principles that should be taken into account, which you see on the right side of the slide. And again, I'm happy to talk about any of those or answer any questions. But we do not want to be presumptuous as a staff in presenting changes to the capital projects you've already authorized and approved in your budget for 2020 and beyond. So as we prepare and organize around these capital projects, it makes sense to take your capital guiding principles to bear as we analyze the various projects, again, if needed, and should that become necessary. As to the timeline of that, I would say that right now, being April 20th, the city is collecting the sales taxes for the month of March. And just to remind everybody, bars and restaurants close March 16th. Pretty well everything else would stay at home on March 26th. We've made a forecast for the decrease in revenues, but those March activities would not necessitate a discussion, a description, and choices of capital project prioritization. And as soon as we've got those revenues organized, accounted for, in fact, businesses have until midnight tonight to file those tax returns and pay those taxes. So we'll be analyzing those in the coming days and reporting those to you. But March will not be the full impact to revenues. Obviously, we know that that's going to be here in April with businesses closed and revenues on a steep decline, and we won't know the impact of that until the May taxes are collected a month from today, and we fully analyze those. So we do have some time to continue to evaluate these capital projects and prioritize them with your guiding principles. So I'll seek some feedback and a dialogue on that here in just a moment. But before I do, I'll just jump into the second item on my report, and that's regarding the Coronavirus Aid, Relief, and Economic Security Act, which we're all referring to as CARES. And in fact, the mayor touched on the Small Business Administration activities just a moment ago, and that is a function of the CARES Act. Well, within the CARES Act itself are many different funds and initiatives, and I just want to speak real briefly on the Coronavirus Relief Fund within CARES. And the Coronavirus Relief Fund allocates From the $2 trillion in stimulus, the fund has an allocation of $340 billion to states and local governments. Local governments are described as those governmental entities with a population of 500,000 or greater, and that would include Adams County and Jefferson County within the state of Colorado. The Joint Budget Commission, the Joint Budget Committee of the Colorado Legislature has done a review of the Coronavirus Relief Fund and estimates that the Adams County and Jefferson County combined allocations could be as much as $190 million. So the city managers from Adams County and Jefferson County are obviously having conversations with their counterparts, the county managers and administrators at Jefferson and Adams County, about the Coronavirus Relief Fund and next steps therein. It's anticipated that those funds will be received by the state in the counties potentially just within the next coming days. And then finally, I would just tell you that I want to report when we receive reimbursements from the CARES Act. I want to report those to you on a periodic basis, and I want to let you know that to date, the city has received a reimbursement from the Coronavirus Relief Fund relative to Medicare ambulance transports in the amount of $31,200. So that's an example where this CARES Act and the Coronavirus Relief Fund therein are beginning to bear fruit and create reimbursements. So both under Westy Rise and the CARES Act, you can see that funds are beginning to flow. And then you can also hopefully have a look at these guiding principles. We welcome your feedback and thoughts as we prepare for the next steps in our financial analysis. With that, I'd be happy to answer any questions, Mr. Mayor and members of City Council.
Okay, Mr. Seymour.
Yes, thank you, Mr. Mayor. I apologize that I didn't get the question typed in when it was relevant, but Mr. Dorr, if I could ask too, as far as from a business standpoint, are we addressing the needs of the business community and addressing any potential for late filing because businesses' staffs are spread out all over the city?
Okay, thank you, Mr. Seymour. Let's see, I think your question is in terms of tax remittance and those kinds of things, payments to the city. Absolutely. I mean, we want to engage with our business community who may have challenges filing, challenges paying. That goes for really any time, and attempt to work out those individual circumstances and situations, work out whatever payment plans might be possible, but no two situations are the same. So we're hoping to engage with those particular businesses on what they're hearing and what they're feeling. And in fact, I can tell you that I'm not aware of any businesses reaching out to the city at this point, expressing significant difficulties filing or paying, but I'd certainly be happy to report those to you here in the near future. Again, the deadline is tonight, and we could learn about more of those in the near future, so I'd be glad to report those to you, sir.
Thank you very much. That's all, Mr. Mayor.
Ms. Sykes, do you have a question?
Thank you again, Deputy Manager Dorr, for a really thorough and thoughtful presentation. I truly appreciate you bringing back kind of the criteria that you're using to prioritize the different cash-funded capital projects in our CIP. I wanted to ask a couple of questions on that just to make sure I understand it accurately. One of the bullet points, it's the fourth one down, was preserve assets. And so anyone who's owned a car or, with their own home maintenance, there's some fixes that are cheaper if you do them initially, right? So putting oil in your car versus having to replace an engine. Would kind of capital improvements that lower the long-term cost of maintaining infrastructure be included in that preserves assets? Would that be encapsulated in that?
Yes, thank you for the question. Absolutely. And the one that comes to mind immediately is overlay and maintenance and repair of streets. It's just a factor of many multiples, 7, 8, 9, 10 times the cost to completely replace a street than it is to maintain it over a period of years. So absolutely, the idea here is that through typical maintenance, it ensures the asset lasts for its expected lifetime, as opposed to having to replace it perhaps a little bit later, but at a much higher cost. So absolutely, the idea is to preserve what the city already owns and make sure that our community can enjoy it.
And then my next question for you is the policy commitments. Does that include strategic plan policy commitments? So prioritizing things that have been made a high value or high level of focus by the City Council?
Thank you. Yes, you hit it on the head. And sometimes some of those policy commitments can address the needs of other governmental entities or other property owners, whatnot, across the community. So absolutely, those policy commitments, and under each of your capital projects, you've described the benefit to the community and those policy commitments therein. And so absolutely, any adjustment to your capital plan would include the impact of either withdrawing or extending those various policy commitments. So we would certainly address those in any changes.
Well, thank you. I appreciate that you're putting thought, and I'm not surprised, but I appreciate the thought put into making sure we have a sustainable and resilient community through our CIP, and how we prioritize what we might need to remove. So thank you.
Are there other questions from council to Mr. Dorr at this time? Larry, I want to go back to your one comment about the CARES Act and the dollar value of, not dollar value, but populations of 500,000 or more. There's only 5 counties in the state that qualify for that 500. And I know that some of the issues that have been raised is the laws regarding the CARES Act leaves that into the county. As I recall, and Don, you and I have had some conversation about this offline, and I know you're already talking to the county. There's not a mandate that the county share that, but we're working off good faith that both the counties will share that down to the municipal areas. Have you had any feedback so far on where we're at on that?
Thank you, Mr. Mayor, for the question. I've had comprehensive conversations with both Ray Gonzalez and Don Davis from Adams County and Jefferson County as their managers, who will be making recommendations to the boards of county commissioners. And they have very specifically been along the line of sharing revenues for us cities that have had significant impacts. We are part of their counties, and I think it's recognized that we'll need some support too. But it will be ultimately up to the county commissioners as to how they approach this. And of course, the counties have needs. So we'll have to see what that split looks like, and we'll keep you posted on that. You will hear, I just want to make a comment on this. You'll hear today, and you'll hear in coming days, that Congress is thinking about appropriating more money for local governments because they didn't hit those local governments below 500,000 in population. I want to tell you that if they do, that money will be appropriated, in my opinion, would be added to take care of those communities that do not reside within 500,000 population jurisdictions. So I wouldn't be hopeful that the next round would be anything Westminster would even be eligible for, frankly, because we've been in the